maybe tell. Hi, so can you tell me who you are and why you're here?
I'm Max Pappas, and I'm the Vice President for Policy at FreedomWorks. We're a national grassroots organization with members in every state. We've been working hard against the healthcare bill all year.
Okay, why is this bill bad?
This $1 trillion bill, this 2,700-page monstrosity that tries to rewrite a sixth of our economy. I think that
one.
that's is part of the reason that it's a problem. The government doesn't have the best track record of taking control of things and making them better. The bill, as the Washington Post said yesterday, or an op-ed in the Washington Post said, fails to address all of the real problems with the healthcare system. And there are loads of real problems. This does nothing to remove the skew of the tax system that ties us to our employer, for example, with our healthcare. So when you lose your job, you also lose your healthcare. That's something that could get bipartisan support to get fixed. It does nothing to put the consumer back in the middle of the healthcare transaction. Part of the reason prices go up is that there are no prices that any of us know in the healthcare system like we do anywhere else. You go to the grocery store, you know what milk is going to cost. You go to the doctor, you don't really know what anything is going to cost, so the price mechanism doesn't function like it does everywhere else. We need to put the consumer back in the middle of it so we can do what we do everywhere else to put pressure on prices going downward. This does the opposite. This just tries to do government control of prices, and there's a long history of government price control. There are lots of people who remember the gas shortage in the 70s when they tried to control gas prices. There are two ways to do this. You can lower prices through the price mechanism and competitive pressure, or you can have the government try to force prices down, which just creates shortages because you have the monetary cost or the opportunity cost of having to wait longer. That's why you hear the argument about longer lines developing. I lived in England for a while. I lived in England for most of the late 90s, so I know what their system is like, and there were much longer waits and worse care. It's just the way it is, and there was still a two-tiered system. Those who could afford it bought out. Those who couldn't still had to pay higher taxes and got the state system. And I grew up in Massachusetts, and in Massachusetts they have a lot of what they're proposing in Capitol Hill right now. My parents have seen their health insurance go through the roof since they imposed this. They went from paying about $400 a month about 5 years ago to paying over $1,200 a month now. They can't afford that. I mean, that's just too much. And I'm fighting this because I don't want that to happen to everybody in the country. And I think we can stop this because the American people are really standing up, and the congressmen just have to listen.
What do you think of the process that they've been trying to push it through, like the Slaughter Amendment?
That's not how major social change takes place. There's a long history of major social change and major votes in the United States. And the Wall Street Journal has done some great reporting on this. It's always done with a broad majority and a broad bipartisan vote. That shows that it's a sustainable consensus that the American people want. If they sneak this through with 50 votes, it shows that there isn't the broad support that they need for this type of reform to make it sustainable.